Minister of Health, Dr. Frank Anthony, says as the country's COVID-19 vaccination campaign progresses, there has been a positive response by citizens. During Tuesday's COVID-19 update, the minister gave a breakdown.
We have had, I would say, fairly good uptake with the adult population. So we've had, for first dose, 78.8% of our adult population taking a first dose vaccine. So that's 404,122 doses of vaccines. That's first dose. Second dose, we've had 283,505 persons, which amounts to about 55.3% of our adult population. But we have had some challenges. So even among the adult population, the over 60 has been doing quite well. So somebody who is 60 years and older, first dose is right now at 80.4%, and second dose is at 68.6%. So that's relatively good, but we still have to get up those numbers. Now, for the 40 to 59 age group, we have had first dose in this age group at 78.8% and second dose at 60.7%. And then for the 18 to the 39 age group, first dose is at 75.1%, but second dose is at 48.1%. So the second dose here for this 18 to 39 age group is relatively low. And again, we keep emphasizing the point that if you only get one dose of the vaccine, it is not going to give you full protection. And therefore, persons who are between 18 and 39 who would have taken a first dose vaccine, we are asking them to come forward to get that second dose, because we need more people to complete the series and to make sure that they are protected. And then for the children, again, the 12 to 17 age group, the first dose is still lagging behind. That's at 40.5%. And second dose is at 28.4%.
Minister Anthony noted that more needs to be done to ensure the younger population is protected.
We really need to do a lot more work here. And parents can help us, teachers, other influential persons in the community. They need to help us to talk to young people in these communities to make sure that they get vaccinated. We had worked very closely with the Ministry of Education to encourage those in school to come and get vaccinated. We did some of these vaccination exercises at the school, and we'll continue to do them. But within the community themselves, there are persons probably who dropped out of school. They need to come forward, come to one of the centers and get vaccinated. Again, there might be multiple factors, because some people maybe don't believe that they can get COVID. There's a lot of myth that is going around that in younger people, you probably get mild COVID and you don't get severely sick. But that's not true, depending on whether you have some comorbidity, or in some cases, young people between the ages of 12 and 17, they can get the more severe form of COVID. And we have seen that, and in Guyana we have had cases where young people with comorbidities have died from COVID. So the best way to protect yourself is really to get vaccinated. And again, we want to urge persons who work with young people, who have some influence over young people, to really talk to them about getting vaccinated. Sports clubs, for example, you have a lot of cricket clubs and football clubs and different sports where a lot of young people would go to play sports. I think those clubs should run vaccination campaign to make sure that their members are fully vaccinated. So there are different ways in which you can help. Wherever activities where young people are gathering, we need to get those persons who are coordinating those activities to ensure that the young people are getting vaccinated.
While there has been a tremendous uptake in the first dose of vaccines, persons are being encouraged to return for their second dose.
So there's a lot of room for improvement by regions. And unfortunately, those regions that have low vaccination rates, we can expect to see surges in cases where there's low vaccination rates. So while right now, maybe in some of these regions, things appear to be a little bit calm, because they're not vaccinated, we can anticipate that we would get cases in these areas because they just don't have immunity within that given population. So to prevent people from getting sick and getting hospitalized and dying from COVID in these regions, the only alternative is to get vaccinated. So we hope that people understand that they should go out and get vaccinated. So you have for first dose adult 404,122, that's 78.8% of our adult population. Second dose is 283,505, that's 55.3% of our adult population. And in terms of the 12 to 17, we have done 29,509 persons, that's 40.5% of that age cohort. And second dose, that's 20,728, or 28.4% of that age cohort. Booster doses is now at 3,189. So that's gradually going up.
This has been today's COVID-19 update. For more information, visit dpi.gov.gy or health.gov.gy and our social media platforms.